And we are live. Happy Thursday, everyone. Happy Thursday on National Public Health Week. We'll be talking more about new tools and innovations and that intersection with public health. I'm very excited for today's guest. I will admit that this is probably the topic that I am the most least confident in topic wise around the subject matter expertise, but I'm glad that I have some experts here that are really going to guide the conversation, and I will just be the facilitator of the vibes for today. Before we get into anything, I did want to just give us a little bit of some grounding, just talking about new tools and innovation and public health. So technologies are tools that can help us improve public health outcomes. Tech provides advanced tools to obtain accurate, detailed population data and response in real time. Technology's impact on public health encompasses a lot, including AI technology, COVID-19 testing kits, data transformation, geospatial technology, wearable tech, telehealth, social media monitoring, emergency preparedness systems. We must center equity and advancements to technology and public health. This is to ensure that communities most impacted are given access to novel solutions. Come get the following questions answered. How can new technology be used to promote equity? How can generative AI be a catalyst for public health? What is the modernized anti-racist data ecosystem? I am so lucky to be joined with experts on all these topics and more today who are going to really dive in and talk about these topics. But before we get into anything, I would love for you all to introduce yourselves and tell us how you are showing up today.
I'll start. My name is Pat Leomi. I'm founder and chief AI educator at Boston AI Learning Hub. I launched this business to provide a one-on-one and group training on how to use generative AI in the workplace. I've noticed a real power difference between AI users and non-users, and I want to help bridge that gap however I can. I study this problem at Northeastern University as a Doctor of Education student. I also hold a Master of Public Health and Healthcare Management, which helps me really explore this issue further with the different multiple intersecting perspectives. And today I feel fantastic. I gave a really good chat on ChatGPT earlier this week, and it's got me feeling in a great place to show up confidently here today.
Nice. I'll go next. Hi, everyone. My name is Lynn. I am a program officer at the de Beaumont Foundation. I have a master's in public health, specifically in epidemiology, and my career has spanned kind of the data lifespan from like the analysis collection kind of role to what we do with that data programmatically, ultimately in public health practice. And, I'm showing up feeling good. The sun is shining today. It's Thursday afternoon, and it's been a great public health week. And so thank you for having me.
And I guess that leaves me. So hi, everyone. I'm Jefferson McMillan-Wilhoit. I'm the Chief Executive Officer for Flourish and Thrive Labs. We're a public health consulting company that is trying to really reimagine how public health gets done. We work with local, state, and federal public health partners to build resilient workforces and resilient systems and processes in public health. Before coming to F&T, I was the Chief Information Officer and Chief Data Officer at the Lake County Health Department in Illinois. And I've been in public health, it has been about 15 years. I have a master's in public health and a master's in public administration. I'm also working on a doctorate of public health. And I just I like to say that I'm a public health informaticist, which sounds really weird. But it just basically means that I straddle the world of public health and tech and making sure that the public health practitioners get what they need out of the technology that we have. And I am showing up, although the weather today sucked, I'm actually doing really well. So I'm just north of Chicago, so we got some snow. But my wife and I are expecting our second child in August, and we got to find out the sex today. So it was a fun day.
Congrats.
Yeah, congrats. That's an exciting day. I hope you're celebrating with that lovely bow tie that you're wearing there.
Yes.
Awesome. But looking forward to diving more into this conversation and just hearing more about your expertise. I will kick it off with Jefferson. So in your work, you've conceptualized and implemented a successful go-to-market strategy for local public health data transformation, securing contracts with over 39 million over a decade. Can you talk more about this?
Yeah, so we started our company because what we found is that local public health departments are really left behind when we talk about data modernization, and we talk about data science and the application of good technology in local public health, in public health in general. So the CDC tends to be really focused on a lot of this, and they do a lot of things at the federal level. Our state partners do a lot of great work in this. But at the end of the day, it's the boots on the ground local health providers and practitioners who are really going to be at the tip of the spear in data modernization. So what we've looked to do is help local public health departments, particularly those serving communities less than 25,000 people, so your uber small health departments, really look at what they're doing and how they're using and leveraging technology to expand their workforce, build it, bring in more resilience into the workforce, and give them what our larger health departments, so those that serve like large cities, have access to in a way that they can access it both from a financial perspective as well as from an approachability perspective. And it's been really great to see. What we found is that we actually have to go back to basics a lot of times with our local health partners. And when I say basics, it's usually not the data that we're talking about or even data modernization. Most of our projects surprisingly start with helping them do a strategic plan and helping them do their community health assessment and their community health improvement plan. And that's a cool jumping off point that we then can talk about data modernization and how they can better use technology and how they can bring in and leverage new tools. So it's been an interesting mix. We've been doing this work for a little bit under 2 years now, and it's been super exciting.
That is awesome. And guests, feel free to jump in at any point in time and add to the conversation. As I said, this is the area that I think I'm least expert in out of all the topics that are covered for National Public Health Week. Everyone that is checking us in live, be sure to hit that like button. Be sure to share this with a friend or someone who gets some value from this conversation. We are now getting started. And if you have questions for any of the guests tonight, feel free to drop them in chat and I will ask them at the appropriate time. But thank you, Jefferson, for that. I think that really does help inform the conversation. I'm glad that you're doing that work because many times we think about local public health and we think about data modernization, but we don't think about what are the capacity needs that those local health department needs and how can we meet them where they're at. And as you said, like build out that strategic plan, build out that community health needs assessment, and then build upon that to really support them to get them the leverage because we know they might have capacity in all the same ways that bigger metro areas have. So appreciate that work. Look forward to learning more about that in the future. And Pat, you shared earlier that you were doing some talks around public health and generative AI and the gap in AI between people that use AI and non-AI users, which I think is fascinating. And I think there's going to be a lot more conversations around public health and generative AI. So can you talk more about generative AI as a catalyst for public health?
This is something I'm extremely excited about. I think generative AI has basically unlimited potential to improve public health. There's so many ways that these tools can benefit practitioners and the people that they serve. So let's think about the public health researcher for whom English isn't their native language. Sometimes these individuals find it really hard to get published in a mainstream journal because they use an irregular form of American English. This person now has access to smart tools like Grammarly, Gemini, or ChatGPT that allows this person to upload their research and have it corrected for grammar, syntax, and common usage in ways that word spell check could never compare. This means a higher number of publications from a more diverse workforce, which translates to an increased diversity of thought and representation in mainstream, high-impact journals, and everybody wins. Or you could consider the public health practitioner who's trying to improve a controversial health topic. Let's say cigarettes. They want to craft the best message possible to challenge deeply held good faith arguments about why someone smokes. But let's say this person is also a novice in their field. They might not know where to start. This person can turn to ChatGPT and write, "I love smoking. Steel man this argument." Steel manning is the opposite of straw manning an argument when someone comes up with the best series of good faith arguments in favor of a specific point of view. So ChatGPT will produce a series of good faith arguments in favor of smoking, and the person can then practice refuting those arguments. And you can do this with any topic. This will level the playing field and enable people to reach across the aisle in ways that used to only be possible with considerable time, money, and resources that are notably sparse in public health.
That's amazing. And that's like very tangible use case for anyone that's coming into this space, is like using the AI as a way to get your opposition, get that conversation, and kind of hear what are the objections, what are the things that people are thinking, and really how can you work with the AI to build better behaviors, work with them to like create a better environment. That's awesome. And I think like we do not even understand how much AI is going to be impactful to public health as yet. But I'm glad that you are here with us today and able to share more about that.
Thank you.
Mm-hmm.
And then moving on to Lynn. What is Made for Health Justice and why is it needed?
Great question, Omari. And I just, as you know, a quick side note before I get started, I'm really excited to talk to everyone today because I think it's just like a few people who are really excited about the different parts of data and tech getting together to talk shop. And so really glad that you guys are here today. But so specific to Made for Health Justice and true to public health style, MADE is an acronym, MADE, which stands for Modernized Anti-Racist Data Ecosystems for Health Justice. And it's a partnership between the de Beaumont Foundation and the Robert Wood Johnson Foundation. And basically, it's an initiative that is supporting the creation of 4 data ecosystems across the US. We have a team in Baltimore, Pittsburgh, Portland, and Tucson, and 4 unique data ecosystems with 4 unique teams in pursuit of a goal that is affecting their communities. So, for example, it could be about climate change or social and economic mobility for youth, and just things like that that are very near and dear to our public health hearts, right? And what I really love about MADE is that it's grounded in 4 values of equity, justice, anti-racism, as you could guess, and community power. And it is needed in public health and maybe, just as people who are working towards addressing drivers of health, because it really is about data justice at its core. It positions community members as drivers and decision makers in the creation of this data ecosystem, as opposed to our traditional community engagement model in public health that positions community residents as like stamps of approval or sounding boards or, an afterthought after the agenda has already been set, after, everything's said and done, and then you give a nod to the community members. Like, this is trying to flip that on its head in pursuit of better data, more representative, more whole data, so that we can ultimately serve communities better. And our working definition of data justice really is about using and collecting and honoring different forms of knowledge and knowing. So that's our traditional quantitative kind of information, but also qualitative storytelling, and those kinds of things, and lived experiences, of course, that really are community-centered and counter to the systemic erasure that we see with more traditional data that we use in public health or, in social sectors.
Well, that's awesome. And I think the storytelling part, the lived experience part of the data oftentimes gets left out, but many times it is some of the most like rich, impactful data. I always think back to my time when I was in Alaska and I did photo voice, and I was working with some Native Alaskan tribes, and a lot of the things that came up was centered around culture and nature, and there just aren't those types of questions that are asked in big data sets. So I think it just like shows why it's so important to include those ways, as well as you will hear a lot of those types of populations say that we're tired of hearing about our data because it always says that we're the worst around this. That like, how can we find other ways to frame the data and frame the stories of our data that isn't so negative, but it's more like asset based and shines that light on that. And love the deep community engagement that is a part of that work, and that's awesome to see the de Beaumont Foundation as well as the Robert Wood Johnson Foundation like really pushing that, because I think that's something that needs to happen globally more often than not. And
yeah, and just one thing, Lynn, I'm interested in your, right, one of the things that we see a lot in our work is particularly when we're in this past the heart of the COVID-19 pandemic, right? And like health departments are starting to rebuild. And what we've heard, and like I felt this when I was in a local health department, but like what we've heard from our clients too, is this lack of trust from the community in public health. And like that's something, and so I'm curious on, how that ends up impacting the work that you do, or just like in general, the idea of how data gets presented, because we saw the negative effects of that in COVID, right? Like when there's zero trust in those of us preparing the data, and Pat too, from an AI perspective, that's a conversation that we're having a lot too, is around the trust in AI and those stories that get crafted. Like how can we help build public trust in that? Because I think that's a huge part of the public health problem that we have to address in the next couple of years.
Yeah, definitely. That's one of our like $1 million questions in public health, right? And in my last life, I worked a lot with local health departments in maternal child health too. So I think I identify very well with what you're describing, Jeff. And I often say that community-based work, community engagement, whatever you want to call it, is some of the hardest work we will ever do as public health people, but it is also some of the most impactful, like transformative, effective things that we'll ever do too, because the answer is often in the community, the answer is in the room. But to address that trust in MAID specifically, we decided to fund community-based organizations who are already doing community organizing or community power building work. And then a part of the team dynamic in our initiative asks for the partnership and collaboration with government. And that can be like a local health department, but we're engaging with a mayor's office, a board of education, city planning, so different, kinds of government partners. But MAID is built in such a way that some of that community relationship is already there. And then through the initiative, with leadership from the organizations at the center, still working to solidify and crystallize those relationships between all of the entities involved, including the community residents. But it definitely is a huge challenge, but so worthwhile.
Yeah. I mean, at the end of the day, right? Like we serve our community, and like I've always said this, whoever holds the data holds the power, right? Because we get to tell the story. And that's just, it's a real interesting thing as we've gone out and tried to help local health departments like really utilize and show their data and share their story and those sorts of things. It's like, we also have to think about, if you're sharing the story, that means you hold the power. So it is your job to then go and democratize that power out into your community, because it's their data, right? Like at the end of the day, it's data about them. And so, how that gets interpreted should be interpreted in a group and not just by those of us who have high level degrees in, epi or biostat or whatever.
I think the AI aspect of how you build the trust in AI would be like twofold. One is the boots on the ground. So having people like me come in and train people one at a time to just get that grassroots movement of trust going in that direction. And I think the other side is also what I'm trying to study in my program, is how you build that top-down trust, where you have people who are at the forefront, at the very top of the organization, actually demonstrating those values, and that's going to build buy-in from those at the lower ends.
Love that question, Jeff, and like that direction, because I think as you're saying, as we're coming out of the pandemic, quote unquote, depending on who you are, trust is a big thing that has come up. And I believe the Doberman Foundation also has a toolkit workbook around building trust in public health communication, which I think is a huge thing, and there's a lot that needs to be done. But I think I would like to lift up the point that Lynn shared around working with partners that are already doing the work, that already have existing relationships, and like really building off of that and seeing who's already creating those networks of power and really plugging into them and supporting them. And I love the idea of continuing to democratize the data, and whoever holds the data holds the power. And then even when you do hold that data and that power, how do you go alongside community to get their input, to get their feedback, to really make it something that they can buy into, I think is important, and a really good point to make. So moving us along a little bit. So how do we transform how organizations operate in this digital age?
Well, that's a loaded question. How much time do we have for this? Like, I think it's right when we're dealing with public health entities who are still doing things on facts. So, circa 1990, 1980 technology, it is not like we can't just like drop new tech into the public health sphere and be like, here you go, done. You now have this new tech. It's like giving somebody the keys to a shiny new Ferrari and not teaching them how to drive. We have to go back we got to go back to the basics. We have to meet public health, whether it's local, state, federal, or our community partners, because they have to be included in this too. We have to meet them where they are in their data journey, wherever that happens to be. So, when we work with clients, we have a maturity model that we use, that we developed, and wherever you are on that maturity model, it's fine. It's not good, bad, or otherwise. It just is. It's a statement of fact. And there are going to be organizations that are easier to digitally transform because they've already gone down that road, or they are newer and they have sort of started in that way. But I think it really comes down to, particularly for any of the technologists that are going to step in to one of these organizations and try to do digital transformation, we have to be humble about it. And we have to recognize that our ecosystem is outdated, and that we need to meet everyone where they are and help them along that journey, rather than prodding them and forcing them along the journey.
Right. And to build on that, when I hear this question, my brain immediately goes back to the concept of data justice, right? Because data itself is not new. It's certainly not going anywhere, and there's so much of it. So regardless of what lane you're working in public health, what sector you're working in, what level, whether it's policy level change or direct service programmatic level work, you're going to touch data. And so the information that we have at our disposal creates that map of the different landmarks, pit stops, and everything that a community experiences on the journey towards health equity and creating healthy communities and promoting healthy communities, right? And so it's again, kind of what you were saying, Jeff, meeting people where they are, and also positioning people as the drivers in this journey towards health equity and healthy communities, right? So if we approach a community about something like tree canopies, for example, and it's a part of our roadmap to talk about tree canopy and green space, and then the community tells us no, I don't want to take a left turn down tree canopies, even though it's important. I want to take a right turn to talk about housing because I can't afford rent, and I think that is more pressing. And so when you meet people where they are and talk about the things they want to talk about, armed with the different information, the data, the tools that we have, I think that is a transformative thing to do. And it's less about the shiny new tools and stuff like that. When it comes to data justice, it's just that perspective that we take. And honestly, with emergent things like AI, what a better time to, build in data justice and these kinds of equity-focused principles to ensure that the tools that we do introduce to public health, the tools that we do offer to people are, with the right kind of parameters and guardrails in place.
Lynn, I want to ping into something really quickly on what you said, this idea of bringing an organization or community into operating in the digital age should never happen in a silo, right? We shouldn't just be focused, at least my opinion is we should never just be focused on how do we operate in the digital age, because at the end of the day, digitization, data modernization, whatever you want to call it, bringing the latest and greatest tools and technology into public health, those should all be done in support of the end goal, which is caring for a community. And so it needs to be directly tied to their journey, their health equity journey, and their desires to move forward on social drivers of health, and their, abilities to create healthy and well communities. Like, we should never, I would advocate that we should never lead with, here are the tools, here's the tech, here's how you operate in a digital world. It's, what is it that you want to, what is it that you and your community want to do, and what tools are out there to help you do that? And some of them may not be the shiniest of tools, right? They may be very basic, and that is okay. And I think sometimes those get overlooked in that because we want to lead with the tech. But I really want to, I loved what you said about, like, it's on the journey to health equity that we bring organizations into the digital age.
This question sits at the heart of what I'm studying. There's a lot of people that need cultivated minds and hearts to get them to be more willing to try out these tools. And there's a tendency for people to fall into one of 5 categories of what we call diffusion of innovation. It's this nice bell curve where half of all people are really excited about new technologies and half of all people just wait until last minute, if at all. And these people at the end of it are falling behind and losing a competitive edge in every form of life right now if they're pitted against the person who knows how to use AI. And I think we need to invest a lot more time and money into researching that. And I think that gets a lot into what Jeff was saying about, like, how to do that. Like, that's a big question, and I don't know the answer to that, but I'm really hoping to find out just systems that produce greater interest in adopting these technologies.
And kind of on this train of thought, because a lot of people that listen to this and that will listen to this will probably be students, early career professionals, as they're thinking about going along in their career and thinking about data and AI. What kinds of advice do you give to them to better navigate their career or make better impact as they're going along their career?
I'm looking at the guy who's getting the EDD. That's what.
Yeah, I'm thinking. I think don't be afraid to try. Like, that's the crucial thing right here that I want to communicate to people is, like, half the conversations that I have with people right now are just trying to convince them that they're not going to get slaughtered by AI in the next 5 years. Like, it's this big fear around whether or not it's useful and whether or not it works and who's using what data. But there are safety mechanisms in place to ensure that these programs are safe. There's a company called Outlier AI that provides quality assurance control to AI systems so that a real human reads AI output to check if it's racist, sexist, homophobic, or otherwise offensive. And that, I don't know where I'm going with this.
Yeah,
lost my train of thought.
I love that. Like, my motto for anyone is, like, just try stuff. Like, don't overanalyze it. Go in, try it, because I think I have yet to meet somebody who's going into public health who would read something offensive and be like, "Yep, that's right. I'm gonna go put that out in the world." Like, I don't know that anyone in this industry would do that. Maybe they would, but, like, I love the way where you're going with that, Pat. Is like, we can't, like, especially newly coming in, these are digital natives who have grown up with technology. Even more so, like, I'm a millennial and I felt like I had grown up with technology, and no, like, they are so linked into technology. And I think the advice is like, try things, don't be afraid. But at the same time, my advice is be respectful of the people who have been in this industry for 25 or 30 years because they know something. Learn from them, right? Like you want to like, I love to see, we were just out at a health department a couple weeks ago, and I just love to see the meld between somebody who is later in their career, who looks at technology and is like, what in the world am I doing? And somebody who this was their first job out of NPH and they had been at this health department for a couple weeks. And just to see the two of them like interact with each other and like come up with new solutions together was, I don't know what perfect looks like, but that would be my idea of perfect, right? Like that's what I would encourage new like students, early career professionals. They've got a lot of talent, they've got a lot of things, they've got a lot of ideas about tech, and they shouldn't be afraid to try it. But do that while learning from the people who have been in the industry for a while.
Isn't that what you were just getting at? Isn't that what I don't know the name for it, but when they have a junior person mentor and a more experienced person, yeah, that's like a big trend right now, right?
I think so. Yeah, I don't remember what I'm with you. I don't remember what it's called, but yes, that is and honestly, like it's actually, that came out of the world of computer programming, because we used to do what was called Gemini programming, where you'd have two developers, usually one a senior and one a junior, and it wasn't just so that the junior dev could learn from the senior dev. It was also like that junior dev just came out of college and like knows the newest stuff that they've been teaching. And so like you pick up some really good things. And I also think that that's a thing for those of us who have been in the industry for a while, is to also be humble with our newer colleagues and recognize that they may know something we don't.
What you're making me think of is like, what, people are using Python now? No, we use SAS here.
Right?
SAS
no. Let me pull out my abacus for you.
No, but I just want to like double, maybe triple down on the idea of just going for it. I think that's good life advice in general. Good advice for early career, but I think just good advice for public health professionals too, because I think something that we get caught up on is waiting for perfection maybe, or like making sure that we have a plan before we go and, deliver this program, do this thing. But sometimes you take it out there, try it out, change what doesn't work, make it better, try it again, and just go for it. That's great advice.
Now, what's really interesting is I think we probably would get a lot of pushback on that and saying, well, look at what happened in COVID when we just tried stuff.
That's
and
true.
Then like
that
all of a sudden we didn't build any trust, right? But like my response to that, and I'd love to hear y'all's response, but like my response to that is, well, the challenge there is we didn't admit soon enough when we made a mistake and we needed to pivot, right? Like, or we didn't educate our community well enough that public health is about experimentation and it's about trying. Like, people don't go to a doctor and are like, well, we tried this treatment and it didn't work, so let's try a new one. That's like, everybody's cool with that, right? But you come to public health land and we do the same thing, and all of a sudden nobody trusts us because we didn't know what we were talking about. And I think it's interesting, Lynn, what you said about like public health has a history of like always wanting to have a plan and always wanting to hit perfection. And I think that has worked against us in some ways, because now we're trying to change it to say, well, we just need to try stuff because that's what new technology and innovation is all about. But when we've lived in a world of public health always has a plan and we're always right, we need to do some work on re-educating our community that we're not always going to be right. And that actually takes, I think, a lot of courage for public health practitioners to be like, you know what, I'm not always going to be right. Because at the end of the day, we're funded by tax dollars, right? And like,
yeah, that makes me think about message crafting too, right? And it's about like saying and being transparent about like, we're trying this may not work, or there could be better ways of doing this, but crafting it in such a way that it doesn't diminish trust, or that it promotes, the appreciation that like, hey, we're trying, we're doing our best, and work with us, give us feedback, and then we'll make it better.
Oh, I love that. Like making sure that like, because I wonder too how much of that may have been an impact of like that trust, the loss of trust is that we weren't very explicit about saying like, give us your feedback. And it's probably because we were, working in an emergency and like trying to do things quickly, and that's cool. But it also comes down to we didn't have that solid footing foundation of being in our community either. Because if we did, then it would have been natural. And so that's, I think, like as public health, part of our bringing in new tech and new tools, we need to do it in order to build the foundation of trust in our community so that when the next public health emergency happens, everybody knows we're going to try stuff, we're going to pivot, we're going to do things quickly, but we're going to do it with you and you're going to do it with us.
Well, I think it's also the fact that there wasn't unified messaging during the pandemic, that you had the federal government saying one thing about bleach and then someone else saying something about not using bleach. So it's like, who do you trust here? And when very powerful people are saying things that are very misleading, that really disrupts trust. And we're at a point now where we can try to rebuild that trust by just reunifying the messaging and getting more people on the same page and saying, this is what we actually mean. But I think that takes a lot more coordination than we currently have.
I wonder, Pat, like, where could AI help in that, right? Because like I'm thinking about normally like when a business part when one of my colleagues and I use the same prompt in Claude, we get slightly different answers, but not wildly different, right? Like they're most of the time on the same page. So like I'm thinking about having like public health communications person crafting a message. If every public health communications person across the country was using the same AI model, maybe one even specially trained on public health communication, how could that help with coordination?
So I think that you have to, there's a couple things there. That's a loaded, very loaded question.
Yeah, I know. I threw a lot at you.
Yeah. So when you look at the AI, what it's doing is it's creating something brand new every single time. So it's never going to look exactly the same. It will have the same elements of the conversation. Like it's not just going to make up something new about COVID. It's going to stay to the same general script, but it's going to take the nuance of the question every single time, and that subtle nuance is going to change those outputs very dramatically in some cases. Just by adding in like this person's an expert, like that word expert will change it to make it much more formal, much more lofty. But I think you could get there by doing something like with ChatGPT, you have the custom GPTs that you can build, which if you're not familiar, it's a bot within a bot that you can build where you feed it a bunch of information and you tell it, this is what I want you to specialize in. And then you can upload as many as 20 files and get that to tell it to do something specialized. Like I have one that knows how to write in my writing style, that I use if I'm feeling lazy and I want to get something done quick.
That is the marker of a PhD student or a doctoral student right there.
Yeah, I think that would get us more toward that direction if you had a custom GPT built that was distributed across the nation. I mean, any one of us could do it and throw it into the App Store, and it would potentially hit a good audience if you advertised it on the public health Millennial.
Right. I mean, right, but that's actually a really fascinating idea, right? Of like we all as public health, decide who the authority is to be, or not who the authority, I don't know, right? But like there's got to be some governance. I would presume that we'd have to have some governance around it. But like if we're trying to get this unified message and unified voice out, using something like the custom GPTs is actually a really cool idea where somebody, like whoever that authority is, let's say it's, for instance, CDC, they develop it and then send it out to every local health department and say, here you go. right? Like, I feel like that would be a really interesting use of that. And I had never thought of that before.
I think it would work, but the caveat is that you have to have people trained and competent on
Yeah,
ChatGPT from the
that's fair.
get-go. So that's where I come in and hopefully help out.
No, and I think that goes back too to what we were talking about earlier, right? About like building this foundation, not just the foundation of trust within a community and the foundation of working with your community, but also like that technical foundation for when CDC does develop their custom GPT and send it to all of us and say, here is your communication toolkit. No longer are we sending you social media images to use. We are sending you a custom GPT.
We're sending you a robot.
Right? We're sending you a robot. Here you go.
No, this is great conversation, and I think like in my head, that sounds like a very good solution. I don't know, other people out there might shoot it down, but I feel like it is a good starting point. And I think these are the kind of conversations that we need to have, because one of the biggest issues that we did see during the pandemic was that lack of unified messaging and just getting a lot of different messages from different places. And I think undergirding all of that and what we've been talking about as a conversation is, even with technology, there still needs to be relationships. There still needs to be a connection with the community. There still needs to be places for the community to engage with us and to really hold us accountable and really decide which way they want to go with different solutions. And I think a deeper through line of this conversation, and Pat kind of spoke to it a little bit, but is the health equity part of things. So what strategies can be employed to ensure that the advancements in technology are leveraged to promote health equity and improve outcomes for individuals and populations?
I mean, I can start with an opening volley. I was just thinking about, especially really, really honing in on the health equity part and thinking more broadly about what even is data, right? What do we consider data? Are we limiting ourselves by only considering, this survey or that survey or this way of knowing, that way of knowing? Like in some spheres, art is data, like culture is data. And so really scrutinizing that and how we will shift power to ensure that communities are in the driver's seat. We've talked about this a little bit already, alluded to it, and just being cognizant of the role that maybe coming from a very like public health practice lens, sitting in a seat of power as like a government employee or as me as a person who works at a foundation, of just being very aware of that power dynamic there and how it plays out when you are working with data and setting agendas and prioritizing, funding opportunities or programmatic opportunities. And then making sure that it's reflective of the people it represents as well. And then I also think about like what tech promotes for people. And when I hear like making sure people have access to new tech, I think about like making sure people have a way to connect with each other, access to care, information sharing. Like my brain immediately goes to like the Hand the Health alert network, but like other ways of information sharing, especially during a pandemic, and just making sure that it's inclusive. It sounds so basic, but when you think about tech, it's like you gotta be able to pay for an app or the internet or a device, a phone, a smartphone. My parents still use flip phones, so like if you were gonna tell them to use an app on their smartphone, that's not an accessible tech, right? That's not equitable. And so just thinking just very basic, like getting back to the foundation of what we try to do in public health and just applying the same values to tech, to accessing new things.
Yeah, I like what you said about representing the people it is made for, because that's one of the things when I was thinking about this question, like inclusive design is paramount. So like in the context of AI, this means training the model not just on the dominant voice, but actively seeking out representative data so that you can have a chatbot that responds to Chicano or Black English dialects that might not be as well represented. So you actually have to actively seek that out. And then I also think you kind of hit on it with like investing on the infrastructure and the training to really have people understand how to utilize these tools in a free, accessible way. And I think that we've seen efforts in the current administration to get in that direction, but we definitely have a long way to go.
Yeah, and I think it's interesting because in a lot of public health methods, we talk about member checking, like particularly if we think about like qualitative methods. We do a lot of things where we'll do focus groups, we'll come out with some results, and then we always say that at the very end or somewhere in the process, you need to check with members of that community for their lived experience to make sure that whatever data you have collected, whether it be quantitative or qualitative, matches their lived experience. And if it doesn't, you know that there's some level of bias there. But we don't often talk about that with tech. We don't say that like when we're going to go implement a new system, let's say a state's implementing a new disease surveillance system or a new immunization information system. We don't often say, well, somewhere in there we need to go member check and we need to make sure that like the tech decisions that we're making, the way that we're implementing this, the assumptions that we're making are accurate with the community. And I think that that's one of the things that will lead us into being able to use tech to promote the health equity and health justice that we want to see. By any chance, have any of you read Cathy O'Neill's book, Weapons of Math Destruction? Okay. You need to. There is no paid support here. It's just you need to go read it. But it's really this very interesting deep dive into the ethics of not necessarily like machine learning and artificial intelligence, but the deep dive into algorithms in general, whether those be like paper-based algorithms, like in the book she talks about the sentencing algorithms that judges use for different like sentencing levels. Those are not computer-based, those are paper-based. But how most of the algorithms that we have developed and continue to develop are self-reinforcing algorithms, where like they're going to constantly reinforce the bias of whoever created them. And I think that is very true for any new tech that we bring into public health, is that we all inherently, when we design technology, when we implement it, when we use it, we are coming at it with a bias. And if we don't realize that we're coming at it with a bias and try to find ways to mitigate the risks that come with that, the systems are inherently going to be potentially even more detrimental to health justice than just us doing things on paper, because now all of a sudden this system has access to hundreds of thousands of data points. And you can really, there's another great book called Lying with Statistics, another one I really enjoy, that like you can do some real damage with that much data. And so I think that's understanding that we have a natural bias coming into it in whatever part of tech, and making sure that we always go back to our community. And I love, Lynn, that you've just been heralding that message throughout this whole conversation, because I think it is so critical and so missed in the like new tech and tools conversation.
I think that really hints at something important when you're talking about the bias and self-checking. I think that also hints at the need for increased regulation and oversight, because you can't trust people to do these things themselves every single time.
Yeah.
And like I was talking about outlier AI, which is a great concept, but it's completely voluntary and only some companies use it, and there's no regulation that is up to speed on that. So we have to modernize current regulation to be able to withstand stuff, especially AI. American politicians cannot tell you how AI works. One guy was like, just straight up said, I have no effing clue what that is, like completely lost. And these are the people who are writing the regulations. So it's not going to be near where it should be.
Yeah.
Yeah. Did you see, I'm curious, Pat, if you saw, I saw something passing in the news about how they're wanting to establish like an AI focused position in each like branch of the government, or like in like specific offices of the government or something, to kind of stay on top of like the development of AI and how it can maybe be used in government. I'm not sure if you've seen anything about that.
I didn't see that, but I really want to look into that. That sounds awesome.
And another
So
curiosity.
Oh, go ahead.
Sorry, just real quick. I saw a commercial for something called like Watson X or something like that. That's supposed to be another one of these like safeguarding AI kind of services. Just curious if you guys have heard anything about that.
No, I've only heard of Outlier, and that's because I'm currently trying to write prompts for them. Um, but that's the only one that I'm familiar with.
Yeah, I know that I've seen, I think every AI company is trying to figure out how to put guardrails on this, which I think is really great. Just to go back to the question that you asked right before that about like having like an AI focused position in each part of the government. We need to learn a little bit from history on whether or not that's going to work, because we did the same thing with data, right? We said every part of the government needs to have a chief data officer. And then you saw everyone in private industry start to have chief data officers. And now, I mean, I'm seeing it across the board in government and in private sector of like everybody's now trying to hire chief AI officers because like that's like the new big thing. And I don't know that a new position focused on something is necessarily going to work, because it didn't with data. It took a lot more than just a new position at an agency to really get the agency to embrace utilizing data to make decisions.
I just saw something about this where someone was making the prediction that the chief AI officer is going to go away very quickly within the next 5 years, and it's just going to be reabsorbed back into the chief operating officer.
Yeah, or I've seen a couple of positions now come out, not in government, but in the healthcare space, I've seen a couple of positions now come out where it's the chief data and AI officer. So they're just like tacking that on. And again, it's just like this is fraught with challenges, because like we need to look at history and see that like just adding somebody who is supposedly and this, they are experts. Like every chief data officer that I've met, and even the people who are taking chief AI officer roles, like they are incredibly intelligent. They know their stuff. That like the AI folks, they know AI. These are like former AI researchers who are taking these positions. They know it, but at the same time, it takes more than one person, right? And we're not building the ecosystem around them for them to be successful.
Great conversation here. And I would just lift up a quick question in chat. People are asking if you'll have read the article called Cut the Noise. It's about cutting the noise in the judicial system and how there's unwanted variability in decision hygiene.
So I think I may have seen, I didn't read the article, but I think I may have seen a commentary on it, because there's been a lot of conversation around like what extraneous information do we throw out into the world. Like if you don't know, in the federal government, if you ever wanted to find like all of the bad news that the federal government wants to throw out, look at any news feed from a government agency at about 2 o'clock on a Friday afternoon, because that is when they're going to drop all of the bad news, and it'll be in one large chunk. And I think that it's an interesting idea about. I love the cat, Pat. That was great.
Likewise.
I was wondering when a cat or a dog or a child was going to show up on this conversation.
Last minute.
Yeah, there you go. I love it. But I think that like it is interesting how much, when we talk about data versus noise, it's interesting how much noise gets put out in public health. And I wonder, again, how much that leads into like the mistrust that the public has for us.
Absolutely. And I know that we are wrapping up soon. So I think you all kind of alluded to this in the conversation around the ethical considerations that must be taken in to ensure that new tools are implemented, new tools and innovations in public health are implemented to really support equitable access to technologies across diverse populations. Was there anything more that any of you all wanted to add to that part of the conversation?
I don't think the answer to this question is very complex. I think it's the same way that we would approach any research or practice. We have to have consent and autonomy, privacy and data protection, and confronting bias and all of these things. That's what we already do, what we're supposed to do. So, yeah, but I cut you off, Lynn.
No, I completely agree. And I was just gonna say that somebody brought up governance earlier, and I just want to like bring that right back because that is a big part of the MADE initiative, especially as we are exploring the impact of like accountability agreements and data charters in building a cross-sector multi-organization data ecosystem, and like that transparency in how the data is governed, who accesses it, what is collected, how it's analyzed, how it's shared, all of these different things related to using, processing, and sharing data are definitely a part of like the ethics that we should consider in using data in public health.
And I think at the end of the day, and this has been my mantra ever since I started my career in public health, the data that we work with and the data that these tools store, utilize, and generate information from, at the end of the day, represent a person. Mm-hmm. So we need to protect the data in the same way that we would protect that human being, because that data is a representation of them. It's a digital representation, and we sometimes forget about that, but it is a representation of their being. And so we have to, as professionals who have chosen a field where we are protecting the health and well-being of people, part of making sure that people are well is making sure that their data is used ethically and appropriately, and not in ways that will jeopardize their health.
I really like that.
Yeah, I love that as well. I don't think I've heard that enough, so I'm glad that you raised that up. I think that's important. And last question that I asked for everyone. So we're talking about new tools and innovation in public health. What is exciting you right now as you are working in the field?
I'll jump in here. So my wife has been trying to get me to use Claude for like the longest time. So Claude is one of the large language models that's put out by Anthropic. I have been like an OpenAI person for a very long time, for like since they released GPT-3. And so like I have sworn allegiance to OpenAI. And the other day I tried Claude for something and I was blown away. And so I think like that is the thing that I am most excited about right now, is having rediscovered Claude.
Amazing. I'm gonna have to check Claude out.
You should. Yeah. It is like I was no bad like mouthing OpenAI, because like GPT-4 and Turbo are great, but Claude just like went above and beyond. I had to do very little editing on that text that came back.
And it has like a 1 million token window, which means that you can upload like multiple books and it will still remember what it's talking about.
And I think that's like the biggest thing, is like how big its token window is in comparison to some of the other models.
So obviously what I'm excited about is also AI. I just recently watched an interview between Sam Altman, the founder of OpenAI and ChatGPT, and Lex Fridman, a MIT podcaster. And it was just amazing to see how sincere Sam Altman is. I had this image of like another Zuckerberg or another one of those type of people, but he was so humble, and he was like, I think ChatGPT 4 sucks. And he's like, by that I mean like 3.5 already sucks and it's only been a few months. So what's coming next is going to be even better. And he couldn't give any details about GPT-5 or when it's coming out, but it's coming. It's supposed to be better, bigger, and more powerful than anything we can imagine. And I'm just so excited about that, because I think AI is going to move mountains and solve decades-old problems in public health. And I couldn't be more excited about that.
I'm glad we had this conversation today, because I admittedly am a little bit more hesitant about AI because in my brain, like separate from, its benefits in my work life, in my brain, I'm like, oh my God, like are bots being trained on Reddit and Twitter? And like what are we, instilling in these bots that are, so powerful? But I am excited to have had this conversation with you guys so that we could talk more about like judicious use of AI and how impactful and positively it can be for the field. And of course, if you guys couldn't tell already, I'm very excited for what we see come out of the Made for Health Justice initiative, just because like the need for something like this is not necessarily new, but existence of ecosystems like this are maybe, I don't know if they exist. I have not come across one yet. So I'm just really excited to see what our 4 communities are able to create for their neighborhoods and for their residents. So it's an exciting time to, be thinking about tech and data and where we can go from here.
Absolutely. This was a very timely conversation. I learned a lot. I took a lot of notes, and I'm hoping to write up some takeaways from all the live sessions that I've been on. I've been hosting, I should say, this past week. But thank you all so much for coming on and sharing your expertise. This will not be the last time that we chat, and I'm very grateful for having this conversation today. So thank you, Lynn. Thank you, Jeff, and thank you, Pat, so much.
Thank you.
Yeah,
Thank you.
guys.
That's great.
Yeah, so thank you all for tuning in. Be sure to hit that like button, share this with someone who'll get some value from the conversation. And you can meet me back here tomorrow at 6 p.m. for another day of panels for National Public Health Week. Good night, everyone. Okay, and we are off live.